and she has interest in non-communicable diseases and nutrition for autism spectrum disorders. I think Lady Elizabeth is going to start first, followed by Ernestina. So, Lady, please take the podium, virtual podium. You're
Thank you.
very welcome.
Thank you.
Okay.
Thank you. Thank you for your warm introduction. Like I'm sharing my screen. One sec. Yes, I did it. All right. Thank you all so much. Oh, hi. I'm just going to stop sharing in my video now so that I can concentrate on talking to you guys and not be looking at myself so much. And once again, it's a pleasure to be talking to you all again. Last month we were in inclusion webinar, and I'm sure we met most of you there as well. So today is more like a continuation of what we talked about in the inclusion webinar. And today we are talking about sensory processing disorders. And I'll touch lightly on how sensory processing and picky eating sort of go together. And then I'll hand over to Ernestina. Yes. So, yeah, like Dr. Mabel said, I am presently in Boston University finishing up my Doctor of Occupational Therapy thingy. And if you do want to find me, that will be me, and that's my contact information or anything else you need. Today's topic will be pretty straight to the point. We'll talk about the basic senses. We'll run it through briefly, talk about what SPD. So SPD is sensory processing disorder, and then the subtypes of sensory processing disorders, what is the way forward, and then the conclusion. So we basically have 5 senses plus 3. I say 5 senses plus 3 because most of us know the basic 5 that we always talk about. And then there's 3: vestibular, proprioception, and interoception. So the basic ones are sight, touch, sound, taste, and smell. These 3 air quote hidden senses, it helps us to tell how fast we are moving or how slow we are moving, how high up we are, or how much pressure we need to open a bottle, or how, if our stomach hurts, like how would we be able to tell if we need to eat, if we need to pee. So interoception is our ability to perceive our inner feelings, and then there's vestibular, and then there's proprioception, in addition to our 5 basic senses. Sensory processing disorder, we cannot talk about the disorder without first knowing what sensory processing itself is. So basically, sensory processing has to do with the way the nervous system perceives sensory information and sort of interprets it into useful responses. And we do this all the time. Everything we do, we are basically processing some kind of sensory information. If we are, as basic things, if we are watching TV, we are sitting down, appreciating visual information through our eyes. If we need to touch the remote and change channels, we are using our sense of touch. So basically, everything we do has some aspect of sensory processing going on. And it has become a big, big subject now, so much so that lots of areas, lots of fields are getting to know more about sensory processing, sensory integration, sensory modulation, all things concerning sensory information. Now, the disorder comes about when the sensory signals are not organized or they are not properly translated, so you don't get the appropriate responses that you are looking for. And when that happens, it disrupts the person's routine or the person's activity. Basically, anything that causes you to sort of not be able to interpret sensory signals properly for your body to provide the appropriate response is what we call sensory processing disorder. Some of the atypical responses that you get from poor sensory processing will be, it affects your behavior and emotion, can affect your attention, it can affect your motor abilities and organization, it can affect your social participation, it can affect your self-regulation. And all of these things together can affect a child's self-esteem. For example, when you're having difficulty with like loud gatherings, or like your child does not like to go to church, oh no, it's not acceptable, because you cannot do that. How can we go to church and only you will be shouting and throwing yourself on the floor? So we have to like think of it like, this child has poor behavior, poor manners, blah, blah, blah. Probably the child is struggling with processing all the activity and noise that comes with being in a church or in a chapel. Attention, you don't have enough attention to be able to focus on a particular task, because everything that is around you is sort of stimulating to you, or you do not understand what is happening to you. Sometimes it affects your motor abilities. So there's also a praxis part of the sensory integration or sensory processing test. Sometimes it can affect the way you perceive like height, or depth. So depth perception, when they are climbing stairs, they are not able to tell how high the next step is or how low the next step is. So you realize they look a bit clumsy, or when they are trying to grasp onto something, they miss it narrowly. They don't know how much force to be able to use to hold the pencil or open things. So then everything about them looks a bit clumsy. Then there's social participation. If you don't understand the social cues, participating in it is a bit hard. All of these put together brings you to a place of poor self-regulation. With the sensory processing disorder, there are three basic types or subtypes. There's the sensory-based motor disorder, which has to do with the praxis parts that we talked about. They like slouching, their posture is poor, they walk a little clumsily, they drop things, they're not very organized. Then there's sensory discrimination, the ability to tell all the various senses apart. You remember we talked about the 8 senses earlier. For your ability to tell all those things, all those individual senses apart, and be able to know the function of each and all of those senses. Then there's modulation. Modulation is the ability to receive the information and then sort of organize them sense by sense and know which ones to tune in at which times and which ones to tune out. So that when you're doing your homework and the TV is on, some children will survive it. Like they'll be able to tune out the background noise and focus on what's important. Other children will not. And under the modulation, there's over responsiveness and then there's under responsiveness. There's a baseline where we all are. Remember, all of this we are talking about is a continuum. There's a baseline where we all are. In the middle there somewhere. And then there are children who are extremely responsive, like their response to some of the sensory information is way up there. And then some of them, their response is way beneath the middle. So for example, if you have a child who is not able to stay put, say sit down in one place, what do we think? Is he over responsive or is he under responsive? It depends. It depends on what we are looking at. If your child is, say, unable to appreciate the child is standing right before you and you have called him like several times, Amma, then you have to like nudge him or shake him or her a little before they are like looking at you. They're like, okay, maybe a little under responsive. Over responsive, the fan is making noise or the TV is making that static noise. They are like all over the place because they can appreciate that very annoying sound which has been going on for a really, really long time and they cannot deal with it. Another school of thought categorizes it into these. These are sensory processing preferences. So these are avoiding registration, seeking, and sensitivity. So these are processing styles or processing preferences. The school of thought says that in these four category of people, also, which is a continuum, it's not like you have sensory avoiding behavior, so that means that you translate into something else. It's a continuum. It's like, just like we have over responsiveness and under responsiveness as the big thing, you can have avoiding behaviors on certain sensory stimuli, like the sense of touch. So there are children who would not like to wear certain textures of clothes, like if it's too dry or it is too like satin or wool, any of those textures, they will not prefer those. So they will try to avoid those specific textures. And they can have like avoiding behaviors from all the way from over responsive all the way to under responsive. So they fall on the avoiding continuum all the way. Then there's registration. Some of them just aren't able to appreciate the stimuli at all, let alone be able to think about like processing it. Even though all of the things are happening, they're not able to register what is happening around them. So there's over responsiveness all the way to under responsiveness of registration behavior. Then there's seeking. Yes, those are your typical, they will jump from one height to the other. They'll move all over the place. They can't seem to settle down. They are like always up to something, very busy. The busybodies. So they too continue all the way. Then there are those who are sensitive, extra sensitive to everything. They also fall on the continuum all the way. So summary of this page, there are subtypes, three major subtypes: sensory-based motor disorders, sensory discrimination, and sensory modulation. Those are the main subtypes of sensory processing disorders. And then under the sensory modulation disorders, there's over-responsiveness and there's under-responsiveness. And then there are sensory processing preferences or sensory processing styles, or whatever these four things are called. They are avoiding, registration, seeking, and sensitivity. So we'll talk about them briefly as we go on, maybe in as we interact day to day in any of our meetings or whatever. We can be discussing all of these things. But what you need to know is there is a baseline where we all are, and then there are those who are way beneath it, and then there are those who are above it. And you don't need to be all the way down there to have sensory processing disorders, and you don't need to be all the way up there. Variations from the normal, but the most important thing is these variations are causing a disruption in your routine and your ability to engage in activities. So this is the summary of that page. Discrimination, your ability to discriminate the use of visual stimuli, auditory stimuli, tactile stimuli, all of those things, sort it out nicely and be able to interpret that information. Dyspraxia and postural disorders, that's sensory-based motor disorders, and then the sensory modulation disorders. All right, so a typical example of those who have sensory seeking behavior: they enjoy making noise, they like to smell things, they like it when you cuddle them, they like it when they jump around. So there are those who like a lot of sensory stimuli. They like it when it comes to them. The sensitive ones try to, stay clear of, not like they are not really into it, but just enough, just small wears them out, enough for them. So they like to cover their ears when the noise is loud. They are very sensitive to smell. They don't like to be tickled. They don't like to be touched. And like we said earlier, some of it affects their emotional their emotions and their behavior. Because imagine having a child who has a lot of tactile sensitivity, so he does not prefer it when you cuddle him or hold him or squeeze him. And as a mother, the first thing that comes to your mind is to cuddle your child when you pick him or her up. So these children become fussy. They don't seem to want to settle down. They are crying a lot. They are upset. They're like, oh, okay, this child has like it's stressed or has anxiety or has any of those things. Second thing to know too is that, oh, we're all over the place, step by step. How does this translate into having trouble with food? That's one thing I wanted to talk about. You see what we have just talked about right now? It is in all the senses. So your sense of smell has it, your sense of taste has it too, your sense of touch has it. And these senses also go into what you eat, how you feel about what you eat, and how you eat it. So feeding yourself and eating. And like we always tell you, in occupational therapy, feeding and eating are two different things. Feeding is like when you actually bring the food to your mouth, all the things you do before the food gets to your mouth. So using a spoon, using a fork, blah, blah, blah. That's feeding. Eating is when the thing gets into your mouth, how you move the muscles to move the food into the back of your mouth and swallow it. That is eating. So the two things, feeding and eating, are very different things. And all these senses come to play when you're feeding or when you're eating. And imagine having a child who has a strong preference for certain specific smells or tastes, or avoids certain specific smells or tastes, and does not like it when her face is messy or her hands are wet or sticky. And imagine serving this child fufu, and to top it off, you've added the soup on it. Oh man. It's not like even if the fufu was in a separate bowl and the soup was in a separate bowl, like they'll take a minute to appreciate the two textures differently. But as Ghanaian as we are, we served the soup on the fufu or the rice and the stew together. And maybe as good parents, we even mixed it up and mashed it a little. Oh, yeah. So you can see all the ways in which, like appreciating it from a sensory point of view, all the ways that could be unappealing to the child. When we have picky eaters and they struggle with portions of sensory difficulties or they have sensory issues, mixture of textures they don't do well with, mixture of smells and flavors they don't do well with, exploring a variety of taste, smells, textures they also don't do well with. So usually what we do in feeding therapy is to allow time for them to, that's why sometimes we say don't force feed them, because it's like, I don't know, in our context, we like to think that when you face your fears head on, you get over it. But children, they don't forget. They will not forget. Like if somebody came into my therapy session and there was an incident, the same way, like 5 weeks later, 6 weeks later, when I change my outfit, change my hair, and they come back again, they will recognize me. They will know it was me. So they don't forget. Now, if we are like putting different textures, let's go to what we can do. If you have a child who is a picky eater from a sensory perspective, I recommend that we try to separate the textures as much as possible. Even if it's in the same plate, we should try and separate the sauces from the main meal. Because sometimes you realize that some of them would eat the rice but no stew. Some people eat the stew but no rice. Some people don't eat the chicken you serve or the fish you serve. Whatever chewy thing you serve, they don't eat it. But on a regular day, they'll eat like chips or they'll chew popcorn. All those crunchy snacks, they'll eat it. But when it comes to chewing chicken, they don't want to chew it, or chewing fish. And you're like, how does a person not want to chew chicken or fish? Because in your mind you think it's tasty, so children should like it. They don't prefer the way it smells, or they don't prefer the way it tastes, or they don't prefer the way the texture is. Maybe it's too stringy, like beef. The next thing is to tenderize their meat. If you have children who have difficulty with that, try tenderizing their meat with the meat tenderizer before serving it. That's why some people serve chicken tenders without the bone, chicken nuggets, chicken whatever other things. But as for us, we do like to serve it with the drumstick and the bone so that it looks like a full chicken. But in other places, they try to serve it with a lot less beauty to it. Then the next thing is, if we are going to, if the child has a really difficult time with food, remember all that you're talking about is a continuum. So there will be children who will be, it's not all the children who are on the extreme side. Some of them are in the middle there, heading outward. So some of these useful information may apply. Minor adjustments may apply and may be helpful for some children. But if you realize you have a child whom you are struggling with feeding wise, they are not able to swallow, or they gag, like as the food is going, I can hear retching sounds as if they're wanting to throw up. That's when you need to come speak to us. We need to assess, and then we will be able to help you. All right, moving on. What would we do? What do we do? First, we assess. Second, we plan, and then we treat. In assessing, we will basically take a look at the child. In OT assessments, it's more hands-on than sometimes if it's a formal assessment, the thing is plenty. The questionnaire or whatever we are using is plenty. So sometimes we can like be asking you a lot of questions. But after the first few questions, subsequently it will be more like your child has to do something for us to see, for us to evaluate. Right. So you bring the child in, we look at the child, we play with the child, we run a couple of activities, we see how they do on it, and then we'll be scoring them or be looking out for a number of things from them. Some of the assessment tools that we use, especially when it comes to sensory processing, is the sensory integration praxis test. This SIPT is basically for occupational therapists to use. I don't know which other group of professionals also use it, but I know mainly OTs. The praxis test part has like components that measure a child's motor abilities, like how the child is doing on bilateral activities. Sorry, there are some messages in the chat box. I'm sure I'll look at it after. How the child is doing motor skill wise. And then there's a sensory profile, a very famous sensory profile. If you've ever been in OT and you've had any issues with any sensory related issues, you probably might have done a sensory profile. There's also the sensory processing measure, others like the Miller function and participation test. And then there's also observational tests that the therapist will do. Because mind you, SPD is not, sometimes it doesn't come alone. It comes with other things. So we look out for an occupational therapist. We're equipped to work with children with a host of other situations going on with them. So we'll take a look at the child holistically and be able to find out if there is anything else in addition to the sensory processing thing, or it's just the sensory processing disorder. Then we are able to observe for, during the observation, we observe for post-rotary nystagmus, we observe for visual perceptual tests, we observe for anything, including fine motor, how you're doing on fine motor, how you're doing on your social skills, how you're doing on your self-esteem, all of those things. We even check up to like bullying. Somebody is like making your child feel uncomfortable at school, because maybe they are clumsy, because they have the sensory processing difficulties, or maybe they are unable to tolerate life at assembly, so they will close their ears, and then somebody at school is laughing at them. All of those things. We want to know all of those things. Then we want to know how the family situation is like, what is going on at home, and we can give you helpful resources and helpful tips, tricks, and what's the word? Tips and tricks to be able to implement in your home, so that you don't even have to be bringing him into therapy very regularly. Then, if after our assessment, we'll come together, both parent and child and therapist, and we'll come up with a plan on what we want to do. Remember, OT is parent-centered, and it is about what will work, not parent-centered exactly, family-centered. It's about what will work for the child in the context of his or her family. So we cannot advise, even though it's the same thing we want to do, we might do it differently for two different families, because we look at what will work for you, this family A, versus what will work for you, this family B. We cannot give you the same, say the same sets of recommendations to go and do if, for example, you have like a stay-at-home mom coming in versus you have two parents who work all the time coming in, or if you have somebody coming in with their nanny versus a person just handling the child alone. So we work at your pace, at the family's pace, using resources that the family has to be able to plan and be able to help the children. I didn't talk about what post we're doing is nystagmus source. So basically, what it means is that we try and put the child in a spin dish, or any rotational device, so on a on a scooter, and then we spin the person around for some time, and then when we stop, their eyes, we look at their eyes to see if their eyes are still going on and on and on, or if it just stops when we stop. Oh, hold on. What? Oh, yes. So in our planning phase, talked about parent-centered early intervention. After we have assessed and told the family what is going on with the child. Remember, in our assessment, we'll be able to also tell you which of the senses your child is struggling with. So after our assessment, and we look at the results and we evaluate everything, we can tell you which of the senses your child is struggling with. So it can be tactile, it can be visual. So then, if it's visual and tactile only, and the other senses he's doing well, those things, then our treatment will focus on the tactile sense and the visual sense. And then if the child has like any of the sensory processing styles, like he has like low registration, or has avoiding behavior, like he does not prefer to engage with the stimuli head on, then we can put all of those details down. Okay, number one, he's struggling with tactile, the sense of touch. Number two, he's struggling with the sense of processing visual stimuli. So that's number two. Then, okay, even though it's just these two, he has avoiding behavior. He tries to avoid the visual stimuli. He tries to avoid any tactile. So he does not like to touch. He does not like to have his hair combed. He does not like to brush his blah blah blah. He does not like when food is stuck on his mouth. And he likes looking at the fan. He likes looking at shiny objects. He does not pay attention when there are lots of movement in the room. Okay, now what do we do next? Based on that information that we have found, we plan our intervention. And the big one that we do for sensory processing disorders is the sensory integration therapy, for which you need to be trained in to be able to do. I think talking a little bit more about sensory integration here. Basically, you remember when we talked about how people are supposed to be in the midline. This integration therapy basically focuses on drawing you as closest to the midline as possible, or making you as functional as possible. That is the goal. Because remember, in occupational therapy, everything we do is about facilitating engagement in your day-to-day activity and continuing to help you maintain your routine and all of those things. So if something is disrupting or disturbing your routine, then we have to do something about it. In sensory integration, if like the example I was making, touch, the challenges are with touch, friction, and he has avoiding behaviors. In avoiding behaviors, they don't usually enjoy the stimuli. They try to stay back from the stimuli. So they will not get a chance to explore very much, which also limits their ability to learn. Because children, yeah, learning is almost similar to exploring. So we try to introduce the activities to the child bit by bit. Try to create avenues for the child to explore. Also child-led, because we want the the child to have a sense of accomplishment after he or she has been able to engage in the days or whatever said activity that we planned, right? So the child will put out a few activities in our session, and then most of which are sensory based activities. So you come, there'll be like textured sand, there will be the bubbles, soapy water, there'll be colored rice, there'll be mirrors, there'll be all sorts of things for sensory play and regular play. And then we try to infuse whichever stimuli he's avoiding in there little by little and cause him to experience it just a little bit. Also, very supervised by therapists to look at how he's doing in the session, and then you adjust it in subsequent sessions. That is the cover or the basics of what sensory integration is about. And yes, there's a lot of evidence that supports the efficiency of sensory integration and how it is working for lots of children here. And of course, in our local context, we are yet to come up with a we're yet to come up with a lot of research in the area of sensory integration or sensory processing difficulties or needs or anything like that. That is why, of course, some of us are trying to get to it and then try to see how best we can also come up with research that is specific to our Ghanaian context and all of that. So on that note, we'll leave it here and open the floor up to a lot of questions. I'm sure the more questions we have, the more we will be able to talk about things that we may have missed in the course of the presentation. Yes. All right.
Thank you. Thank you very much, lady. Let me read the first. I think it was a comment, but it has a question mark at the end. Occupational therapists should be working collaboratively with dysphagia teams, which are speech and language therapists, when someone has feeding or eating difficulties, I suppose. So yeah, I think it's both a contribution and a question for you to confirm that in dysphagia teams, would you have both the speech therapist and the occupational therapist working together?
Yes, absolutely. Most of the time, there is both speech and OT working with children with feeding or swallowing difficulties. It's not just children, adults, anybody at all with feeding and swallowing difficulties.
Okay, excellent. So let's open the floor for questions. If you have any questions, can you please raise your hands or type it into the chat box so that we can answer your questions. Our second speaker is having some internet difficulties. She's not been able to join us. I'm not sure how it's going to be, but let's try and answer the questions. Okay, we have some hands raised. If we are not able to get the second speaker on, we'll have to postpone her talk for another time. All right, let's start with Martha Datsy, followed by Gloria, and then followed by Nora. So you can unmute yourself and ask the question, please.
Hello, good evening.
Good
Please,
evening.
in fact, I want to know if a child who is not potty trained does not need to, okay, a child who is not potty trained, the child has also fine motor challenges. And then maybe the child is seeing an OT, but they are working on only potty training. Does that mean the potty training, without the potty training, they can't do any interventions in terms of fine motor activities?
Okay. Thank you, Martha, for your question. Lady, over to you. Can OTs work on daily living skills like potty training and do fine motor skills at the same time? Or do you do it in sequence, one after the other?
Usually, it depends on the context. Maybe if they had already talked about it with the parents, or maybe the parent had indicated that, or maybe one of the things or pressing issues that I want to talk or to tackle is potty training. Like maybe the child is going to start daycare or nursery or something, and they want to get him or her potty trained before, or it's a school requirement. Yes, maybe they might work on potty training for the beginning before they transition to the other things. But if nothing like that was said, they can run it concurrently.
Okay.
Besides, it's activity based. The therapy session is activity based. So we can have like a potty training activity interspersed with a fine motor. It could serve as a nice break or a switch of pace between the two activities. So it can be done.
Okay.
Martha,
Excellent.
does that answer your question?
Okay, Martha.
Somehow, but the thing is, for me, in the classroom setting, a child, fine, they'll definitely will do potty training, but then the child must be engaged in other activities. And then it becomes challenging, especially getting the child to do few things like engage in proper structured activity. Then the child, you can't engage the child. I mean, I'm thinking, and we work in collaboration with parents. And for that matter, I think if we do both, it will be better, because you can't focus on potty training alone at home. And then when the child comes to school, then what next? Because the child should be used to those fine motor activities at home, and then we continue at school. So for me, I think I would suggest, if parents are opting for such, then it should be recommended that they do both.
Okay, so Martha, from where you're coming from, I think it will be individualized. So I don't know whether you're thinking about one particular client, but if you think both are necessary and you are the teacher, have a talk to the OT or to the family and know how you can go about it, because lady is saying you can do both at the same time.
Okay.
Yeah.
All right.
Okay, thank you.
Right. Thank you.
Gloria and then Nora.
Okay. Thank you, Lady Elizabeth, for that nice presentation.
Gloria, you are muted. Hello. Gloria, you're muted. Can you unmute yourself?
Okay, hello. Can you hear me now?
Yes, we can.
Okay, all right. Yes, so Lady Elizabeth, thank you very much. My question is that can you have a child who has a mixture of these sensory issues? So for instance, these hyper and then hypo at the same time. I've seen children who would who would enjoy being tickled, being hugged, and all that, and then would also cover their ears to loud sounds or to noise. So would they be hyper in some areas and then hypo? And then also, what remedy do you have, or what advice you have for children who chew or who grind their teeth? I mean, is it also a sensory issue? And then what's the best approach? Thank you.
Thank you too. Thank you for your questions. They're really, really nice questions. So yes, you can have for lack of a better word, a cocktail of sensory issues. You can have children who are, remember we talked about 4 processing styles or processing preferences. You can have children who are on the continuum on like avoiding behaviors, and then the same child is also on like a registration continuum as well. And then the child can also have difficulty in more than one sensory area, so like visual, tactile, sound, anything. The child can have more than one sense being giving him or her trouble, and then can have like, so like you said, he can enjoy being tickled, then they can also, and they can totally, even the same tickling, they can totally not like it another day. You understand? And there's also children who you can like, today they are very, very hyper. They are like jumping all over the place. Same child, if another person is jumping all over the place, then he is fine. Or they'll be the ones shouting this minute, then the next minute they'll be the ones covering their ears. It's like a cocktail of sensory processing needs happening to the same child at different times. And for children who grind their teeth, yes, there's a lot of oral sensitivity as well. Just like we were talking about children who have difficulty with feeding, being picky eaters, in addition to having like sensory difficulties. Children who grind their teeth is an example of children with oral sensitivity. So usually we have like a device that we use. And recently I was looking up the evidence on how vibration can be used as a way of reducing oral sensitivity, and we found some really, really good information. So there's a tool that is called the Z-Vibe that we use to help with grinding your teeth, those who like have difficulty with chewing or jaw strengthening, lip closure, a lot of things concerning the mouth and teeth and chewing and swallowing and all of those things. Yeah. So if you do see us, we can totally help you out.
Excellent. Thank you.
Dr. Mabo, there's one more.
Yes, we'll take one more. Ernestina is on the line now, so we want to take the second. So let's Nora. Nora, please ask your question, and then kindly, after Nora, we'll go to the second speaker. And lady, can you unshare your screen so that Ernestina can start sharing her screen? Nora, please ask your question.
Okay, thank you very much. This information has been very, very helpful to me, especially because I have been for almost 7 years trying to find solution to how my child is having quite a lot of this sensory disorder things. So I noticed that I think from a year going, I went to the pedia. They perform some. So my child was picky with colors, with textures, and with. It was confusing to me. I had no idea what that was. So I went to the pediatrician, and then they perform some tests. So they will give the child water to swallow, because I said my child stores food in their mouth. The child will swallow. And the pediatrician said there's nothing wrong with the gum, because they were especially through the mouth and the gum and everything. And I said, oh, it's eating, there's no drinking of water. And then even when it is drinking of water, there's you feel like the child is suffering, but the child like, I'm not suffering. So I don't know where a is there a way, as in a pediatrician, the same as, I don't know the term to use, but OTs or something? Because yes, because I have been going in and out almost every year. I have never had on point information this till now.
I see.
Yes.
Wow.
So,
Nora, pediatricians are not occupational therapists, though. So you have been seeing the wrong people.
I was never referred, or I don't know. I was
Oh.
thinking how I could be going on, and then I was not referred to. And in my mind, I thought if it is children, it's supposed to be a pediatrician. So I keep on going to different pediatric clinics and hospitals just to get solution to some of the things that I think.
Yeah. Yeah.
And then my second question too is, so in our school settings, so you have a child with some of this disorders. How well do you liaise with the school with that? Because sometimes you write letters to their class teachers or something, and it's like you are so concerned about, you are quite petty. Yes, when it comes to, I see your child comes, your child is okay, they see it as normal, or train your child at home, or some, I'm saying this in relation to parents. I need some remedies on that. Yes, you can't always change the school, but and then some too come along as the child grows. So at one point the child is not is hyper in terms of behavior. At another point the child is not eating well. At another point, like, is it progressive? Can some of the disorders drop off and new ones be picked alongside? I want to do that too.
Okay. Lady, can you answer in a short one and then continue answering?
Short 30 seconds.
And continue answering for her on the page, okay? On the chat.
Okay.
All right.
Okay. Yes. I think as the child ages, new behaviors come along and some of the old ones drop off. That's you're absolutely right with. But the more you know and understand some of these things, the more aware and conscious you are. Like we always say, yeah, your child's best advocate. If you go somewhere or if you feel there's something going on with your child, most of the time your intuitions are directing you it's in the area there somewhere. So you need to speak to the right people about it. Secondly, we are trying to come to a place where schools can have OTs consulting for them or with them at the same time, but we are not there yet. So when you realize that there's something going on with your child and you get in touch with an occupational therapist, the same occupational therapist who takes care of your child in the clinic or in the home or wherever can also take care of the child at the school, take care of the child at the school. So can actually liaise with your child's school to help them understand what is going on with your child and how best your child can also fit into their school system with a few minor adjustments. Like you said, yes, you cannot always change the school. Please, I will be in the chat area and I'll be texting you small. Please, Auntie Ernestine, I'm done.
Okay, thank you so much, lady. As I told you earlier on, we have two topics today somehow connected. So we want to talk about picky eaters and sensory processing disorder, how they are mixed together. And Ernestina will be doing that for us. She's a dietitian. She's at the Bank Hospital. She has over 12 years experience, and she also has an interest in nutrition in autism spectrum disorders. So Ernestina, please take the podium.
Yeah, thank you very much. And my signal went off part of the first presentation, so forgive me if I repeat some things that may have been already discussed, but I'm not sure I'll do a lot of that. Okay. Okay. So the outline will be on something general on nutrition, and then how sensory processing disorder affects food intake. Tips for meal times to help parents with their children who have challenges with feeding, and then also talk something about supplements and other things that are related to the topic. Okay, so the personality of children with sensory disorders can affect how much they eat. Like it was said before, they'll be sensitive to taste, smell, texture, and then so the appearance of the food and other sounds around them can disrupt them. And this can bring about challenges in feeding, and then they can also become picky eaters as a result of that. And this can also lead to deficiencies. Now, how does the condition affect food intake? The child may avoid foods with certain textures. So may avoid soft foods, some may avoid smooth, some may avoid pureed foods, some may not like foods that are crunchy. They may also avoid foods based on a certain color. So a certain color may put them off, or is too loud for them. They will not like to eat foods of that color, or a certain color may make them want to eat particular foods in that color. And that means it can affect the food choice, and then it can make them picky eaters, avoiding foods that they should or is useful to them. It can also make them dislike certain flavors. So the child may refuse the food just because of how it smells. Not that it smells bad, but to the child, the scent may be too much, or the scent is too little. They can't even smell the food, and that can bring a challenge. And sometimes it's the brand of food. So they may reject a particular product, not because they don't like that particular food. If you try another brand they may like, it may be the packaging or the brand of the container that puts them off. And then also, sometimes it's a particular food group. So they may just like starchy foods. They refuse to eat the protein on the food because they like the texture of the starchy and not the other ingredients. Now, the associated problems based on the sensitivity issues, thinking about those who have who are hypersensitive, it means that if you present food for them and it's too hot, they may take it, it may burn them without them noticing what is happening. So that's how we have to be careful not to scald them. And then also they may refuse new foods. So there may be challenges with introducing new foods to them. They may refuse the food based on the utensil. It could be the color of the utensil, not actually the food, but based on the color of the utensil, there could be challenges with feeding. And then also it may cause them to get upset, leave the table when certain foods are presented. They are also easily disrupted. So when TV is on or when other things that disturb them are around, it may affect how much or if at all they will eat. So nutrition intervention, so still for all children, a healthy diet provides nourishment. And we know that, I don't know if that was touched, but then the condition has to do with nerves. So if you provide adequate nutrition, some say it can help with the condition because the child's nutrients levels help to solve some of these small challenges, okay? And then also children like that have higher energy needs because of inadequate intake and all the challenges. They may be a little undernourished, so their energy needs is high. So that's what we are looking at when considering interventions. So the goal for nutrition education will be to help them to grow. They get good education and nutrition, they're able to learn better and develop better, okay? So even though we're talking about textures and sensitivity, we also have to consider that, like all children, we have to have the idea of the balanced diet in mind. So as much as possible, we are trying to get them to get their carbs, whole carbs, their vegetables and fruits, adequate amount of protein, adequate amount of calcium. So children need about 2 to 3 servings of milk, whether non-dairy or dairy. They need about 2 to 3 servings a day to be able to meet up their requirements. So we have to look at this, and we also have to think about processed foods that they are not too healthy. So if you look at this plate, you see that the ketchup and the sauces and the crisps and things are out. These things are most often sugary and salty, fatty, and we say with bad fats, and we say they are not very healthy. So even though they may be craving for things like that, we should have the idea that we are looking for whole carbs for them, fruit and vegetables, beans, lentils, fish, chicken, meat, it's okay. And then we are still considering giving them milk and then healthy fats. Okay. Foods for sensory and mental. So food is also for sensory and nerve function. And so some of the food groups that have been noted to be useful for them is carbohydrates, and then carbohydrates in general. So if they are able to, we're able to provide them with healthy carbohydrates, so starchy foods, carbohydrate from fruits and vegetables, especially starchy vegetables, it helps to provide a steady source of energy so that they are alert. It helps reduce some of the brain fog because they are getting adequate supply of ready glucose for the mind. And then probiotics have also been known to boost mental health, that when the gut is healthy, it helps with the nerve function of the brain as well. So when we provide them with probiotics, that will help. And as we go down, I'll give you examples of these things. Omega fatty acids have been known to also help with nerve health. Then magnesium is also useful for transfer of electric of these in their foods that will help. So with the omega-3 rich foods, we see that mostly seafood is high in omega-3. So we have our fish, especially oily fish like salmon, sardines, mackerels, fine shellfishes if they can tolerate that. Shrimps and prawns are fine. Whole grain brown rice or wild rice is good. Spinach or our contomere or other greens are fine. Avocado, nuts in general. And then also we could actually supplement as well. So these are good source of omega-3 that is good for function that we should try to introduce to the children. Okay. For the vitamin E, we see that they are similar ingredients. So eggs, avocados, the greens, the nuts, berries now, also garlic and the others are good sources of these. So if you give these to the children, it's also very useful. Okay. Then we have vitamin B. So the vitamin B cuts across green vegetables to plant sources for B12, which is all useful for the nerve function. So we have to try to give them a variety. And then the magnesium. So magnesium is noted to help with electrical signals, so which is useful to them. So with that, we are still looking at bananas, nuts, avocado. So if you look at these foods that are listed, they cut across both our carbs, our nuts, protein, good fats, avocados and nuts again, and whole carbs, so brown rice to oats and the others, and lentils and beans. So if you give them a wide variety of foods, it also helps to children, it helps to build good nerve function, and then it can be useful to them. Now, for the probiotic, there are several types. Most commonly, we have the yogurt as natural source of probiotics. And there are other types. So I've listed a number of them that are, these days, these things are all available in Ghana. You can get some of these to buy. So if your child doesn't like a particular texture, doesn't like the yogurt texture, they may like the tempeh texture. So you can try all of these, some of these, and see which, and we'll see how we introduce these things to children. Okay. So what are some of the tips that we can use to help feed children who have sensory disorders or who are also picky eaters? So it's important to keep a food diary. Sometimes we are not aware what is putting them off. If you have a diary and you can note down what you give to the child that the child is like, what the child likes more, it helps you to identify the textures the child prefers and the colors the child prefers, and that can help you to better present foods that the child would agree with. Okay, and you have to try to stick to your routine. So we can't give breakfast today at 8, and at that time you were cleaning, it was at 10. You get the child confused. You should have a routine. Breakfast time is breakfast time. You set it the same time. Lunch, snack time is this time. Lunch time is this time, so that the child gets used to, I'm hungry at this time. It's time for food, and it's easy for the child to accept what you give. You should also ask the child why he dislikes the food. So sometimes, like I said before, it may not be the food itself, it may be the container. So if a child is refusing the food, you should find out why they don't like it. Which part of the food do they not like? If they're able to talk, is it the taste? Is it the texture? You should try, or is it the color? Or change the plate and see what is causing the child to dislike the particular food. And then it's also useful when we eat together as often as possible. So as a family, if we set the routine and we are all eating together, it's good. It encourages the child to sit down and also enjoy. And then we have to try to offer a variety of foods. So even though the child prefers a particular food, we have to find a way, and we'll discuss that, of introducing new food so that the child gets variety and not stick to just one ingredient. And then also make the healthy food choice available so that the child will have those things to choose from. So if you present limited option of unhealthy food, you're encouraging the child to like unhealthy food. Okay, and we should make mealtime pleasant. So we shouldn't be forced. We are encouraging intake, but we never force a child to eat. We don't make eating a chore. We don't make them cry too much during feeding time so that it becomes a difficult situation. And whenever they see the food, even before tasting, they are already agitated or crying. Okay, so at least we have to offer 3 for children. At least they should get 3 meals and 2 to 3 snacks every day, so that we don't get a lot of disruptions. It may be useful to turn off TV, unless, turn off TV. It will be useful not to use the tablet to as something they hold when they are eating. So let it be feeding time, the food, the table, the particular place they sit all the time, rather than have all these gadgets around that can make them not to eat as much as they should. And then let your child also decide if and how much they want to eat. So you serve healthy food, and then allow your child to feed to their satisfaction. If their child is refusing to eat more of the food, you don't force it down. You can introduce another meal option that is available, or you wait until the next feeding time to feed. And then also you serve food in plates or bowls. So sometimes for some people, the appearance of the food, if it appears too much, they may become irritated. They may not even eat at all. So for children like that, you may want to let them dish there. So you present the food at the table and encourage them to dish as much as they want on their own plate. And that helps to prevent that thing that scares them, that you've given them too much food and they won't even try. And then also resist the urge to comment on what or how much the child is eating. So if the child is eating less, don't let the child know you are too upset about, look at how little you are eating. Or, hey, today you are eating too much, or next time you eat little, and you will be wondering why your child is not eating so much. So we should try not to comment about the food. And then we shouldn't pressure about food. We shouldn't praise them too much when they are eating. We shouldn't, for the picky eaters, we shouldn't offer rewards. For the others with sensory disorders, sometimes rewards are incentives to help them eat more. But for picky eaters, for no reason, rewards should not be. So you don't give particularly a sweet for a child eating healthy food. You make the sweet like a prize so that it appears better than the food that they are eating. So we shouldn't make sweets or candies as rewards for eating healthy food. Okay, and we also shouldn't punish or be upset that they are not eating. So we should try to be as neutral as possible. And then also we should try to avoid giving them water or too much drinks during food time. For some children, immediately food comes down, they want water. So you try to discourage that. Don't even put it at the table unless it is very necessary that they get it, so that you encourage them to eat as much as they can eat, and they can have their drinks in between, especially for a child who is not eating too much at a time. And then sometimes it's good to let them help you with the cooking. Sometimes the fact that they did some work and they've seen how the food has turned out, it encourages the child to eat the food. And then we have to try to be patient. Okay. So I added this thing about vegetables because sometimes it's difficult for a lot of children to take vegetables. So there are some tips that can help. So it is important that, like we saw the plates before, the Healthy Eat Guide plates, at every meal time, there should be vegetables present. And we can encourage the child to pick from the vegetables you have presented. You should know their texture. So if the child doesn't like it hard, it should be soft. If they like it stir-fried, you could try that in your recipes. Sometimes you may want to grate, chop, or blend, mash it so that it is part of the food and then the child cannot pick it out. But if you have a child actually picking out the vegetables, don't shout at them, don't be too upset, allow them to put it away. Next time, present it in a way that they will not be able to pick it out and throw away. So if you mash all your vegetable and mix it up to make a sauce, there's no way they're going to pick it out. So those are some of the things. Sometimes the vegetable can be in the form of the soup. It can be in salad. It can be in the stew. Can be part of the omelets. Even you make muffins and other things and you mix it up with fried rice and pasta. So there's a way of always encouraging a child to have the vegetables, even if they do not want to take it. But we have to try to limit juice intake so that they do not rely only on juice, because juices are low in fiber. So when they get the whole fruit or it's a smoothie, it's better than when we juice it for the child. And another thing too is that when we keep children physically active, it encourages food intake. They get hungry and they're able to eat more. Okay. So tips about how to offer food to a child with sensory disorders or challenges. Now, you have to put the food first on the plate. So you can just leave the offering new food. So something they haven't tried before, you want to get the child to eat, you put it on the plate next to what they are already used to eating. So their food is there and you are introducing this one. So this is also on a plate. You will allow the child to see the new thing you are bringing, the new ingredient that you are bringing, and then you can let them touch it and see it. So they can touch it, they can play around with the food, they can smell it, they can bring it to their lips. You allow them to finger play with the food, encourage them to touch, taste and see. And then as they taste, you see that the texture is okay for them, the taste is fine for them, they would then taste the food and they will try to eat. And then you make sure that that food that they have tried within 2 weeks is presented periodically so that they get used to the new texture, the new food they are offering them. Okay. Now, for some children who may want to eat the same thing over and over again, they only want rice and nothing else, you still have to try to offer. So what they like is present, but then you offer the other things on the side that they can try little of. Then you have to include. So even if they don't like fruits and vegetables, it should always be present. So you don't say, when I give them the fruit, they don't eat, so I have stopped buying. It should always be presented, and then gradually you get to know which textures they like, which flavors they like, which colors, and then they will eat. Then they should try different varieties of their favorite foods. I think I went off.
Yes.
Please, can you hear?
We can hear you, but your slides is off.
Oh, sorry. Let me try to share again. Please, can you see the slide?
Yes, it's back on.
Is it where I was before I went off?
Yeah.
Yeah.
Okay. Okay. So I was saying that you should try different, you should include fruits and vegetables, and then you should try to give them different varieties of their favorite food. So if you identify the child likes potatoes, you can try mashed potato with another vegetable. You can try their potato chips with another vegetable or with other protein sources, so that they are getting different varieties. Because their favorite food is there, it may encourage them to eat the other additives you've added to their favorite. So that's how you try to get them to eat other foods. And then also you can add other ingredients to their favorite food. So you add chicken or carrot pieces to macaroni because they like macaroni and cheese. You fortify milk with their cereal with fortified milk. You add a little bit of yogurt or other things so that you are adding other ingredients, and that encourages them to try varieties. And then as you do that with time, so you give it time, your child will be eating the different foods. Okay. So then about supplements. So ideally when children are eating well, they may not need supplements, but if your child is not eating adequately, you could supplement with a multivitamin. You talk to your doctor about it before you do that, especially because sometimes parents will go for iron supplement. They say the child is not eating well, so they are giving blood tonic, but these things contain iron, and sometimes you could cause iron overload. So if your child doesn't need it, you don't have to. So you talk to your doctor about it. Some of the supplements may give gastrointestinal symptoms, constipation or diarrhea, stomach aches, especially if it's iron, and that could also discourage the child further from eating. So if they don't need it, you don't give. Some research show that for children who were not eating adequately, who were given a multivitamin supplement, it helped them to sleep better. So if your child is having sleep challenges, maybe you could talk to your doctor about it, get a dietitian, assess the intake to see whether it's inadequate, whether your child needs supplement or not. And then with the omega-3 supplement, B vitamin and all that, if your child is eating well, they get adequate. It can also improve behaviors in children who are not eating well if you add those supplements to their diet. Okay, so I added this part because the gluten and casein-free diet for those who also have ASD comes up. So these are foods that do not contain gluten, which is a protein in grains like wheat, like in our local foods, mostly it's wheat that we will find the gluten in, and casein comes from milk protein. So some patients' behaviors improve for those who have spectrum disorders when they are off this. But what we have to note is that it is hard to follow because it offers less variety, and for especially casein foods, that's calcium that I was saying the children need at least 2 to 3 servings. Most often calcium is coming from the milk supplement. So if you take the casein out, you have to be careful, or variety is limited, and it may be the child's favorite food. So the child is already not eating well, and then the favorite food they like is what now you are taking out because of so we have to be sure they really need to be on the casein or gluten-free before we try it. It is also more expensive, and then if they are on it, we may need to supplement because we may not be meeting the nutrient requirement. Okay, so please, thank you. That's the end of my presentation.
Oh, thank you so much. That was excellent. It looks like you were answering my questions as I was asking them in my head. You could read my mind, Ernestina. Thank you so much. That was really good. Okay, so question time. Lady is still on the line, so please ask your questions to our dietitian, and if you still have a few questions for Lady, you can also raise your hand. Let me see if we have any in the chat room. There are some very good comments and personal experiences there. I'm sure we can read it. Okay, but no questions. So I have Beatrice Nyame. Wait, let me ensure you can unmute. Okay, so Beatrice Nyame, you can unmute yourself, followed by Gloria.
Okay, thank you very much, Doctor.
Yes.
Please, my question is that I have a 3-year boy who is on the spectrum. At times, you give him certain food, he will eat. but at times too, he will not eat the same food that I've given him. It's like he likes a particular food at some point, and some other time he doesn't like that same food. But he doesn't. He takes all the textures of food. Just that at times he likes this particular texture. The following time too, he likes another one. So it's like he's picking in and out like that. That's how he behaves. So I want to know whether that one too is a problem in the feeding process. Thank you.
Thank you. Ernestina.
Yeah, hello.
Yeah.
So maybe you should, like I said, sometimes it could be the utensil. Sometimes it may not even be the food. So it could be what is around. It could be disruptions. It may not be the food, but the TV that was on or some other thing that was going on in the home. Maybe a put off. And sometimes too, when the child likes a particular food and we are happy with how much they are eating, then we are presenting the food too often. So even though that's your child's favorite food, sometimes you have to take it away and bring something else so that there's the variety and the child doesn't get bored with seeing the same food. Or you could try adding different ingredients to that particular food they like so that it always appears a little different and your child may eat better.
Okay. Thank you very much.
Thank you. Gloria, and then Eunice.
Okay, thank you very much, Ernestina. Very insightful. My question is on the probiotics in food. You mentioned yogurt, and my question is that for a child who is on a casein-free diet, a child who has allergies, to milk, cow's milk, and so is on a casein-free diet, are there options for getting these probiotics in food? Are there other food options? And then what's your take or your experience on giving these probiotic preparations? You can go to the pharmacy and get the probiotic preparation, and some also administer to these children. So what's your experience with that? Is it helpful? And then the first question is the options in food for someone on a casein-free diet. Thank you.
Okay, so I know that the probiotic preparations from the pharmacies, they are all equally good in terms of providing the probiotic effect. I personally like it when it is in food because you are giving the child something more than just probiotic. If the child gets it in yogurt, they are getting more than probiotics. So they are getting nutrients and they are getting nourishment. But then if the child is on casein-free, I know elsewhere you can get soy yogurt, which has the probiotic inside, but over here we don't have those foods. So you could give the probiotic in the form of the tempeh. So tempeh is a soy product. It is not yogurt. So it is plant-based, but it has probiotic. And then I think sauerkraut is from cabbage, if I'm not mistaken. So the other product on the market that is not casein based that you can use. And I always prefer to give food rather than the raw probiotic, because that one you are just giving probiotic, but when you give it with food, you give nourishment and you give the probiotic as well. So that is also okay.
Okay. Thank you. Where can you get the tempeh? I haven't heard of it before.
Tempeh is quite available. You can get, I'm sure, from a place like Max Mart, you can get tempeh, and even I don't know if not from Melcom, you may be able to get. So from where they sell the cheese section, you find tofu, you can find tempeh and those ones as well.
Okay, thank you. As for sauerkraut, I think you can do it yourself. So if you Google sauerkraut, how to make it yourself, you can do that yourself at home. Okay, Eunice.
Good evening.
Good evening.
Okay, I want to find out, first of all, I think well done for a very insightful presentation. And then I would like to know, is it very normal for a 3-year-old child to not eat any solid food? Like once a while he does jollof, but aside jollof, basically there's no food that the child would want to eat. Is it very normal? And then also, I'm told by his teachers that when he goes to school, this same food, jollof and then noodles and all that, he eats them at school. But then at home, no matter what we do, he doesn't take them. Is it normal? And secondly, is there any way to that I can meet up with a presenter with a child, maybe for further inquiries or discussions? Thank you.
Okay.
Thank you, Eunice. Yeah.
Thank you. So with the jollof issue, it's like what I mentioned, that you identify their favorite food. So that's jollof. So you still give the jollof, but you present other things on the side. So jollof with a little bit of mashed potato on the side, jollof with your cabbage or carrots, softly cooked, mashed with some dressing on the side, jollof with, so always the favorite thing is there, but you present other things on the side that you are somehow encouraging the child to eat. And about the school, so with the school food, sometimes when it's like what I said, that eating together, sometimes when all the friends are eating, they are also encouraged to eat the food. So when food is their food time at home, it shouldn't be this is their food and maybe mommy is busy, daddy will come later. When daddy comes, daddy will eat with mom, but it's 5 o'clock, you have to eat. So you are presenting the child with food. If you all sit and eat together, it encourages the child to, so you may also have to find out, maybe it's taste differences, maybe texture differences. How is the food at school done? You can find out from the school canteen what is different from, so find out exactly what he's getting. And perhaps if you alter your recipe a little, you encourage your child to eat more. Yes, please.
Okay.
Thank you. I also wanted to know whether there's any way you do consultation. Maybe I could meet up with you one-on-one if there is anything like that, right?
Yes, please. Yes, please. If you contact Mission Clinic, the arrangement can be done.
Very
Yeah.
well. Thank you. Okay.
Okay. Okay, Jab or JAB.
Yes, hello.
Yeah.
Good evening. Thank you so much. Very insightful presentation. So about the presenting other alternatives with the favorites, I want to find out how long you have to do that for, because I have a 3-year-old, and similar to the previous participant's question, there's only a particular food he eats. It's, so, and we've tried presenting other foods with it so that he would start leaning towards that, but he would pick it and throw it away, or you put it in his mouth and he spit it out. So I just want to find out how long you have to present the other alternatives with his favorite food.
Thank you. So I think, like we said, it takes time and patience. And then perhaps if you could let me know what his favorite food is, we could find means of maybe not adding other things, but hiding other ingredients inside his favorite food, so that he's still getting the favorite food, but he's getting the other things. Sometimes you may blend other things and mix up with his favorite food, not too much to overshadow the taste of the favorite food. So little things can be done to introduce other food. So perhaps we could talk about what his food is and see what you can add.
That's fine. We will contact you through Mission Pediatrics. I mean, we used to offer him yogurts, and I would add everything to the yogurt, all the things he doesn't eat. But in the last 2 weeks, he has totally rejected the yogurt. So now I'm at a loss. So we will contact you, and then we'll find some solutions.
Yes, please.
Okay. Thank you. Hey, I have more. Okay, let me read a bit of the questions in the chats before we come to the hands-on again. So, Ernestina, somebody was asking a question. I think she means that, is there particular foods prescribed for blood type and for children on the spectrum? Are there specific foods they are supposed to eat or something they are not supposed to eat? And then there's another question that says, does some foods cause seizures to occur?
Okay. So with the blood type, even for adults, there's no food type for any blood type. So it is something that is on the internet that appears to be a good thing, but it's not. And especially for children who we are having difficulties feeding, you don't restrict any food for the sake of blood group, as long as the child likes it and is tolerating, no allergies, no problems, no intolerance, you allow your child to eat. So the blood group diet is not scientifically proven, so don't try it on children. Now with the seizures, for some children, when they take foods that contain too much sugar or has a high glycemic index, it could trigger a seizure. And so if you are giving, for those children, if you are giving foods that contain too much sugar, or foods that become sugar quickly, foods that the carbohydrate is highly refined, it may, for those children, trigger a seizure. And so if you suspect you're having seizure issues related to your diet, you could contact Mission as well. We could have a one-on-one and then see whether we could put you on a diet that can help with the seizures.
Thank you. Thank you very much. So for some of the kids with seizures or epilepsy, there's a ketogenic diet that tries to reduce the sugar content, the refined sugar in the blood content. So definitely high sugars are not good for all children. So try and reduce your sugars in your children's foods. All right. Nora, you have your hands up, I think.
Yes. So my question is, so you have a picky eater, you realize that you're able to use screen time to control what they eat and how much they eat and all that. Is it a good thing? So you offer a food you think on a normal day the child will not eat in front of a screen, and then you use the screen time as, okay, so if you eat this volume or this amount whilst watching this, and then you put it. So at the back of my mind, I know it's not so good, but that helps away for some days. So I really want to know, is this something that is harmful, or is something I have to continue? Or and then my second question is, so I have a 2.5-year-old who used to eat everything, but so for some reasons now things, probably I'm paying attention to the picky eater, so wants to be copying, so will refuse what he used to eat everything, now will be eating. How do you navigate that? Like, communicate to them to accept that they are not so on the same level or something. Thank you.
Okay, so about the picky eating and the child who wasn't before. One thing I think I didn't come up in my presentation, but was in the slides, is that you should discourage them giving a particular food to the picky eater and something else to the other child. So it is important to try to identify what's, like, for those who have sensory disorders, you identify what is triggering the reject, and then try not to offer it. But once the food is prepared for everybody eats that food. So you shouldn't do nothing where maybe everybody is eating wonton and one person is eating tomato stew. Should not be encouraged at home. So everybody is getting the same thing. So if the child refuses to eat that meal, they refuse to eat that meal, you can present another meal soon after, but not to swap and give something else. Otherwise, every time they will reject what you offer because they know you bring something else. So you have to encourage that everybody, is meal time. Daddy, mommy, or mommy, children, everybody's eating this. We are all eating. This is what is available, and you do that. And that can also help for the other children not to feel the other child is getting too much attention. Everybody's eating what everybody's getting. Then for the, you had something else, I'm sorry.
The screen time, using the screen time to control.
Screen time. Ideally, you shouldn't start the screen time. So it may appear to make the child eat, but perhaps the child would have eaten more if they were not watching the TV, so or the screen. So you can try to discourage it little by little. Otherwise, the day that you send the child to grandma or somebody and you forget the screen, or it's low battery, then that day it means that the child is going to be crying and then be irritable the whole day. So try to discourage it little by little until your child doesn't need it anymore. But if you've not started feeding your child and maybe you are a baby, your child is a baby, you are now trying to, don't start with the screen with feeding. It's not a healthy feeding practice.
Thank you very much. We are 7 minutes past our time, but there's one last question I will ask and then we shall close. Somebody is asking whether there are certain foods that can cause drooling in some children.
As for this one,
it's difficult, eh?
You may use the diary thing I talked about. So put the diary down and notice whether certain foods give more drooling than others, and then restrict it and see whether it makes it better. So you may use the diary and it can help.
Yeah, I mean, off the top of my head, I don't know any particular foods that will cause drooling, but I have some clients who mom swears that there are certain foods that increases the drooling. So I think the diary would definitely be the one that will work better. Whether they are intolerant to it, they are allergic to it, it sets their teeth on edge and they drool, I'm not sure. So definitely the diary will be a good one. Dr. Wood is one of our pediatricians. She says that if a child refuses to eat at a particular meal time, can you starve the child and then offer the food again? So if they decide that they are not eating lunch, can you, and you said we shouldn't force them. So then can you decide, okay, then they are not eating, then offer it maybe 2 hours later? Ernestina,
Yes. It's a difficult question. So the child refused to eat at all. If your child is not malnourished, very, very malnourished, you could wait till the next feeding time. But if it's a child that you are worried about, we are concerned about intake, you don't need to wait 2 hours. It could be 30 minutes time. You could offer something. If they refuse that, then you wait till the next feeding time.
Okay.
But I'm thinking if the child is okay, they could wait till the next feeding time.
Okay.
Yeah.
Okay. All right. Thank you very much. That reminds me of I think one of our earlier presentations where we talked about just not picky eaters, but just food refusal, some of the eating disorders where the kids are just having PTSD about the food and just refusing food for all sorts of reasons. I think we have to go back and do that presentation again. Anyway, thank you so much, Lady Elizabeth. And thank you so much, Ernestina, for such insightful presentations. We have learned a lot. You can contact Mission Pediatrics to see Ernestina. Ernestina is also at the Bank Hospital, so you can see her there. And Lady Elizabeth, who has deserted us and is not here, but you can contact her online. She shared her contact details. And if you need to see an occupational therapist, we have a team at Mission Pediatrics. You can also contact us to see an occupational therapist. Thank you so much for making time to join us for today's Parents Roundtable discussions. I hope you have learned a lot, just like I have. Next month, we'll come again with a very interesting topic for discussion with experienced presenters as usual. So make a date with us next month. We shall circulate what the topic is and the date. It's usually the third Saturday of the month. It's on Zoom, 5 p.m. to 6:30. So make a date with us next time.
Thank you so much and have a good evening. Bye.
Same to you. Bye.
Thank you. Bye.
Bye-bye.